I'm a family physician and pediatrician. I've been practicing medicine for about 12 years. And I've had to, as a physician, address the life of the mother exception. I tell my patients, do not get an amniocentesis. An amniocentesis was what the obstetrician orders. About mid-trimester, they'll put a needle in the uterus to draw some fluid and send it for testing and look for genetic abnormalities. Because the whole reason they do an amniocentesis, the whole reason, is so they can offer an option for an abortion if there's evidence of some kind of abnormality. Many times, it's a false positive. Turns out the baby's normal, and they're giving a mom an option to get an abortion, putting fear in her heart that's not there. There's no reason to do an amniocentesis. And when you meet one blind baby who's been blinded because the needle went into the baby's eye, it'll make you think whether this is even good health care at all. But unfortunately, there's been a wrongful life suit. We hear of wrongful death suits. But there's been a wrongful life suit where a baby was born and the pro-life doctor did not recommend an amniocentesis, and the baby was born mentally handicapped, and the parents sued the physician because they weren't offered an opportunity to abort, and they won that lawsuit. And so fear of litigation is driving the need to recommend an amniocentesis so that you can offer an abortion if there's any evidence of an abnormality. And, it's become one of the most corrupt aspects of obstetrics right now. I think there's blame to be put on the medical community for a lack of informed consent. Physicians aren't being honest with patients about why they're doing things and why it's necessary that she get an amniocentesis or that this product can kill their unborn child. They're not telling patients, pro-life patients, that the rubella vaccine is made with aborted fetal tissue and the chickenpox vaccine. We're keeping this under the rug because we don't want people to know. And I think that's fault-worthy. I think that that's malpractice to prescribe a substance or recommend a therapy that can result in the killing of your child without your knowledge. For example, when I was in residency in the emergency room, the ER physician was going to give a rape patient a morning after pill. And I said, sir, you know that one of the ways this operates, according to the 3 modes of action of the morning after pill, it can act as an abortifacient. You haven't informed her that. You should tell her, at least, because if she's pro-life and she discovers later, then you've not given her informed consent. That's very common, where physicians will recommend a therapy that can harm or result in the death of their unborn child and the patient not even know. The official position of the American Academy of Pediatrics is that their pediatricians should help minors get abortion without parental consent. Even if your state has parental consent legislation, they should get a judicial bypass so that they can get an abortion of your grandchild. That is corrupt. That is a group of physicians who have blood on their hands. That's exactly one of the reasons I started the Association of Pro-Life Physicians 6 years ago. Pro-lifers need to find and prefer pro-life doctors, especially now that physician-assisted suicide is legal in several states. So my goal was to find, identify, and promote pro-life physicians, doctors that will not kill patients or refer for abortions, so that anybody could go prolifephysicians.org and find a pro-life physician in their community. Because if you go to a doctor that's willing to do an abortion, that's willing to get judicial bypass in your state so you can bypass parental consent legislation to get that minor child of yours to get an abortion without your consent, you're responsible because you consulted that physician not even knowing or maybe even aware of his godless attitude about life. And so we need to find physicians that respect life, and we need to refer them in our consultation for medical care, and we need to re-stigmatize doctors in our communities who are willing to kill people. They are Joseph Mengeles. They are to be spurned. In our community, we have 15 doctors that are pro-life without exception from 12 different specialties. So there's no reason for anyone to go to any doctor that's willing to kill one innocent baby. Congressman Ron Paul is an OBGYN who has delivered thousands of babies, and he said he's never seen a case in which abortion was necessary to save the life of the mother. Now, I've seen many physicians recommend abortion to save the life of the mother, but in essence, they're trying to protect themselves. For example, in the case in which Dr. Tommy Mitchell justified an abortion, maternal chemotherapy, when that woman goes to the oncologist and the oncologist says, we can cure your chemotherapy, but you got to get the abortion first, because I will not give you chemotherapy if you're pregnant. And so this woman has to get an abortion in order to get treated for a chemotherapy. Why can't they simply just treat the woman? Because if the baby's born deformed, if the baby's born prematurely, if this wanted child is born stillborn, that can affect him by way of litigation. So when a physician recommends an abortion to save the life of the mother, it's very often to protect themselves, not to save the life of the mother, but to protect themselves from lawsuits. There was a study done recently in Europe looking at mothers who refused to get an abortion, who had cancer, and were taking chemotherapy. And the study concluded that maternal chemotherapy was relatively safe for unborn children. So for 40 years, they've been killing all these babies, thousands of babies, because the baby's going to die anyway. And it turns out that maternal chemotherapy is relatively safe for unborn children. Back in the 60s, there was a rubella epidemic. And physicians were arguing, your baby's going to be born blind, your baby's going to be deformed, there's a high miscarriage rate anyway. Let's do the abortion, and at least now you'll be immune. This will never happen again. Well, it turns out 70% of those babies would have been fine. And they were killing all these babies that would have been born with a handicap or would have miscarried anyway. They're killing all these babies when you don't have to kill babies to provide health care. Abortion is not health care.